I'm here today to give you some insight on what it's really like to be 12 months post-op knee replacement. So if you are a new friend of mine and you're just coming across my page, please comment and let me know where you are in the process. And if you're not following me, please come and give me a follow. I have documented and share my whole knee replacement recovery for my right and my left knee. And so I feel that you will find a lot of my content very helpful for your process. Most doctors don't tell you what to expect for the process from start to finish and beyond your actual recovery timeline. A lot of us get trapped in this assumption versus reality bubble. And it isn't until we hit certain milestones that we are completely aware of what life truly will be like. Let me give you some color and let you know exactly what I'm talking about. Pre-op, I know I felt frustrated. I was experiencing brutal bone-on-bone knee pain. I felt like I did not have a quality of life, and I just really wanted to feel normal again. I also knew that after my knee replacement, post-op, I would feel much better than I did pre-op. My doctors told me I would feel much better, however, I didn't know exactly what that meant. So now that I have reached the 12-month milestone, I can help inform you of what the doctors mean by life being better than it was before. I can help you set realistic expectations on the word normal and what that really means. To be honest, I think that's the most important part in a knee replacement recovery is to understand what normal means. Normal is not the same normal that we are used to. The normal that we're used to with how we felt with healthy, God-given knees. I think that if we're well informed that there is a difference between the normal that we knew once upon a time with our healthy knees versus the normal that we will feel post-op knee replacement is two totally different things. We also have to educate ourselves with reality versus expectations post-op. I believe some of us are dissatisfied with the results of our knee replacements because we are expecting to feel like we felt when we had healthy knees. It can also be a little bit difficult to really truly feel that we do really feel better than we did pre-op, but because we have this expectation, this false expectation of what we are thinking we should be, really sets in that disappointment because we don't ever feel like we have and are attaining that feeling that we are thinking we should feel. Let me try to go into some more detail to help you understand exactly what I mean. So, when we had our healthy knees, before bone on bone, before all the pain and arthritis and the things that we were experiencing, we didn't have numbness, pressure, fullness, heaviness, or tightness. We didn't have any of those things with our God-given knees. Many of us do have that now. We have all of those things, and it's a result of our prosthesis. We also didn't feel like our healthy knees were a foreign object or alien-like. We never had a lack in confidence that our knees would buckle or not be strong enough. I don't know about you, but I have that now. I don't have much confidence in my knees because I still feel like I'm struggling with strength. And I feel like I just can't do the things that I was able to do before. But it is very important for me to remind myself that I do not experience that brutal bone-on-bone pain anymore. I also have to remember that I couldn't do any type of activity, but now I'm working my way up to doing different types of low-impact activities, all without pain. Some of us have a negative experience with how our new knee is working. But I feel that's only because we have a false impression on what we should be experiencing. Educating ourselves on what realistic activities and feelings we will have will really help us to appreciate and enjoy our new knee. And to let you all know, that's what I'm doing now. I appreciate all the things that I can do now, although sometimes it does feel weird, like kneeling. But to be quite honest, I will take weird over pain any day. So the moral of the story is that we have to really focus our mind on what reality post knee replacement is versus what our expectations post knee replacement are. It's kind of a set yourself up for success. And I know that the doctors can't really tell you all of these things. You have to experience them for yourselves because we're all different. Some of us may have a totally different experience. Some of us may have a negative experience, a positive experience, or some of us may have a neutral experience, right? And so I am here to just share my personal journey and experience with you and to let you know that this is what I have discovered from my knee replacement, is that I had false impressions, false expectations of what I was going to feel like and be able to do post knee replacement. But now that I'm starting to realize that I don't have pain, I have some discomfort and I have some soreness and stiffness from time to time, some weakness, I'm setting my mind around just understanding that I don't have severe pain and that what I'm feeling now is just my new normal. I will never feel the normal that I felt once upon a time, but that's okay. I will take it. I appreciate my surgeons. I appreciate all of my doctors for giving me my life back. I just have to realize that this is what it's going to be, and I'm totally fine with where I am currently because I don't have pain anymore. So I hope this helps you. Remember, learning what normal and what your new normal is, and also just set yourself up for success and understanding what reality versus false expectations are. So thank you for watching, and comment below if you have any questions.